Hello friends, I have seen so many of the patients who come with one common problem of acidity, or we call it hyperacidity. In this disease, what happens that the patient keeps on complaining of some kind of a gas, chest pain, burning in the chest, behind the chest bone all the time. Whenever they eat a little amount of the food, it gives them the feeling of fullness, dyspepsia, and feel like not to eat anymore, and there is a regurgitation of the food. That means food feels like coming back into their mouth. So we call this disease as a gastroesophageal reflux disease or hyperacidity or GERD, GERD. There is a surgery which is done to correct up the leakage of the valve. If the valve is like this and the food pipe is like this, so there is a leakage of the valve. What we do, we repair the valve and then make up a new valve with the help of the fundus, that means the upper part of the stomach. We do this thing with a big tube inside the stomach so that there is no over tightening of this thing, which is a very common complication which we have seen with the patient who have got their surgery done outside. Surgery is totally done by the robotic or the laparoscopic way with 3 or 4 very small holes in the tummy, and the patient is discharged the very next day and is given a very specific diet of liquid diet for 3 or 4 days, then some soft diet for next 3-4 days, and then returning back to their normal routine food but without any spices. So this surgery helps such patients who have too much of the acidity. Patient are not they don't have to go to any of the doctor to get any sutures removed, because we close all the laparoscopic surgery wounds with dissolving stitches and the glue. Patient can go and take the shower the very same evening of the surgery and can roam around after 4 or 5 hours of the surgery. The result of the surgery comes up within 1 or 2 days. The patients are very happy. They are able to eat and drink without having a fear of the food coming back to their mouth or to their food pipe. And thank you very much.